Welcome to the Prospective Doctor podcast, brought to you by Med School Coach. Pre-med and medical students alike are encouraged to tune in each week for tips on how to become a strong med school candidate, gain acceptance into the school of your dreams, and succeed on your journey toward residency and becoming a doctor.
Hello, everyone. I'm super delighted to have a very special guest today, Dr. Kyle Bradford Jones. I'll give him an opportunity to introduce himself.
Hey, everybody. Thank you for having me. I'm grateful to be on the podcast. But a little bit about me. So I am a family physician. I am an associate professor in family and preventive medicine at the University of Utah School of Medicine. So I see patients, I do some research, I teach residents. I'm kind of all over the place, which I love, which is awesome.
That is awesome.
I grew up in Utah, so this is home. Graduated from Utah State University and then medical school in the Medical College of Wisconsin, and then came back to do residency at the University of Utah, and then joined the faculty once I completed residency. I have a wife and 4 great kids, and I really enjoy baseball, probably more than I should. And I like reading and movies and all sorts of stuff. And then just over a year ago, I published my first book, Fallible, a memoir of a young physician's struggle with mental illness. So I have lots of different things that I do and enjoy, but that's me.
That's awesome. There are a lot of things going on. I too am a family physician, so I get it about having your hands in so many different buckets to kind of keep us going. And that's so exciting. And we have a lot of similarities where I've been following your Instagram, and we'll talk about that later for how people can reach out to you, but just seeing like the children interacting and stuff has been really cool. So lots of commonalities. I will say one thing that we don't have in common though is you mentioned that you love baseball, and I have definitely lived next door to 2 great teams. So when I was in med school, I lived right by Fenway Stadium with the Red Sox. And then when I was in residency, I lived across the street from the Orioles Stadium in Baltimore. But as many games as I went to, I just can't get into it. So
that's too bad. That's all right. We'll try to get to you yet.
Yeah, one day. But there, for the students listening, there is an audience of mostly people who are considering entering medical school and people who are currently there, and we probably have some residents too. What made you choose family medicine since there are so many different specialties?
Yeah, there were a few different things. First of all, I feel like we all kind of enter medicine with a certain picture in our minds of what a doctor is. And the picture I had in my mind was the primary care physician who you see, over the lifespan, and who is someone who knows you really well and that you connect with. And so first of all, that was the picture that I had in my mind. But second of all, I loved that idea of the continuing relationship, and not only caring for specific diseases, but the whole person. Mm-hmm. And I know a lot of people say that, and it's somewhat of a cliche, but I think it's real. I really do enjoy that. My clinical practice right now is I see patients who have a developmental disability. And so I have kind of a niche population, but, I am able to have that long-term relationship with them. And also, I've always been kind of a healthcare policy nerd. I really kind of get energized by a lot of that. And so that was a big part of it too, where I felt like being in family medicine or in primary care, that you have much more access to kind of what's really going on in medicine and a much better perspective on policy issues. And so that was another thing. So it was kind of a lot of different things that drew me in. I went into medical school thinking I was going to be a pediatric oncologist. And there was a time where I was very tempted to go to cardiothoracic surgery. And those are obviously very different from primary care. Mm-hmm. But in the end, kind of all of those things came together that I thought, no, this is my home. These are my people.
I love that. It's all about finding your people. And one of my mentors gave me that advice too, because of course, when you're going through all of the different rotations, everything is exciting, but trying to figure out what you want to do in the long term. And even if you decide to narrow your scope of practice, like right now, what you're doing, which is awesome, because we definitely need to help our patients with disabilities, you're still able to pull from all of the things that you learned via family medicine, as well as figure out how to help with people's illnesses and how they relate to the other parts of the family and things like that. So it's all about that. And like you said, it all comes down to advocating for your patients. So trying to also be involved with that and the advocacy component.
And, it was a great choice for me. Certainly, I know people where it's like, I would rather die than do that. And, everyone has their own thing, but this is definitely the place for me.
Awesome. I will say that we all find our people, and most programs have similarities. And then even when you're in school, there are certain, we all go through very similar experiences. But I would say, what would you say was your biggest challenge during training?
Probably just the relentlessness of it. It never lets up. And, we, like with my book about my issues with anxiety and depression, we do know how when you enter medical school, the rates of mental illness are pretty much the same as everybody else. And then within 2 years, depression and anxiety diagnoses are significantly higher. And, there are so many aspects to that were challenging for me, but also obviously for many others. But part of it was, there's just no break for emotional to a rebound emotionally or mentally. And, that was hard. And you still have, you have some breaks here and there and whatnot, but it's not the same as it was before. And so it's a very difficult transition. And it even steps up a little bit more when you go into residency. And that was a big challenge for me. I was married at the time and had, when I entered medical school, we had our first child. And so that did help, because then when I came home, and you have a 2-year-old, you're all of a sudden in his world. He doesn't care about all the other stuff. And so it really was a way to kind of shift my mind away from things, but it certainly was a challenge.
Absolutely. I definitely know so many of my colleagues who have had similar experiences, because we are under so much stress, and it just, there's one thing when, like, okay, I got to get through the semester. It's going to be hard. And when you're in college, I put 30 credits or something on, but for it to be like a 30 credit semester every 2 weeks is pretty intense. So it's good that you found something to look forward to in terms of going home to your family and your son at the time. But for the listeners out there, you just have to find some way to kind of give yourself self-care and something to look forward to.
Yeah. Well, and it's interesting too, because part of it is just the nature of medicine itself, where, you're dealing with hard things all the time, and, people are suffering, they're dying, and there's really only a limited amount of things that you can do, but they kind of expect you to do more. We know physicians have a higher rate of suicide than the general population, and it's been like that for 100 years, even though the system's changed and our way of educating is changed. And so when I kind of talk about that, and a lot of people say, well, okay, it sounds like this was a terrible experience. Would you really recommend people enter medicine? And I still say, yes, it's still, even with all those challenges, it's still worth it. And it is one of those things where, as long as you kind of know what you're getting into, I think you absolutely should still do it.
I love that answer, because a lot of the students have heard me say on here, it's weird for me to be a person who loves mentorship in medicine and is even hosting this podcast, for me to say, well, if there's anything that you can think of that you want to do other than medicine, try that first. And if you still have the passion, then go into medicine. But we definitely need you here in medicine if you decide to do that, because you guys are the future and you're going to create the culture of the future, and you're going to be the people that are empathetic to your patients, or who are changing the rules and advocating for medical students and residents. But in a time before, there were no work hour restrictions and things like that. And now people have advocated, due to the physician suicide and the unfortunate losses that we've had from exhaustion and accidents and things like that, to make it a little more safer for physicians to still learn quality information, but in a safe, controlled environment. So there is hope out there, and you guys just have to figure out if this is for you, because it's not for some people, and that's okay. Even if you get to school and you realize, like, this isn't really for me. I talked to several people who get there and they feel this burden because they have loans and other responsibilities or family expectations or whatever it is to stick it through. And then they get out and into the world and they're still not happy. So do that soul searching and kind of figure out, like, is this for you? Yeah,
absolutely. No, that's a big part of it. And there are, even within medicine, there are obviously so many different things you can do, whether it's a different specialty as a physician or whether it's a non-physician, and all the different aspects. So if it is healthcare in general that really drives you, but then you find that, well, maybe I don't want to be a physician, you can still be involved and still find something else that really gets you going.
Absolutely. That is one thing. And I think with both of us working and mentoring and teaching students and things like that, I like to say is, how on the personal statements and things, we always kind of look when someone's like, I want to be a doctor because I want to help people. Of course, we all do. You should want to. But there are so many different ways to skin a cat, and you can help people as a nurse or as a healthcare administrator or as a social worker, or even helping people as a teacher. Doctor does mean teacher. And if that's the component that you want to contribute to, that is okay. So just kind of doing that soul searching and figuring out what's right for you.
Absolutely. And it's one of those things too, where, if you're a pre-med student listening to this and you're prepping for medical school interviews, have an answer for why being a physician is how you want to help people. Because, I heard one friend who was going through the interview process and said, well, I want to help people. And the interviewer said, well, nurses help people, so why don't you be a nurse? And he didn't have an answer. He's like, well, I don't know. Understand what it is about the different positions that you want to engage in, and why you feel like that's the best fit for you to help others.
Absolutely. That definitely makes sense. And we may invite you back, or maybe a panel of other docs and you or some other people to maybe do a deeper dive into, like, the next field and phase of applications and how to attack that personal statement and things, and just kind of be true to yourself.
Yeah, absolutely.
At Med School Coach, we know that getting into medical school is hard. In fact, 60% of pre-meds who apply to medical school don't even get accepted. And if you want to get accepted into a top medical school, it's even harder. It's a complicated process, and even students with great grades and MCAT scores get left out. That's why more students than ever are turning to Med School Coach for admissions advising. Our advisors are all physicians and former admissions committee members, so they know exactly what medical schools are looking for. One-on-one admissions advising from Med School Coach makes all the difference. Our expert team will help you develop a game plan, prepare your application, edit your essays, and coach you for interviews. Every pre-med has a story, and we'll help you tell it so you can stand out from the crowd. Visit us online at medschoolcoach.com and use offer code PODCAST10 to save 10% up to $400 on a Med School Coach admissions advising package. You can achieve your medical school dreams, and Med School Coach can help.
So, speaking of writing personal statements, we've mentioned several times that you are an author and you wrote Fallible, a memoir of young physicians' struggle with mental illness. Mm-hmm. We've kind of been hitting on it, but what inspired you to write it, and what topics do you include in the book?
So a couple of things kind of led me to writing it. First of all, I really enjoy writing. So, obviously that's a natural fit, and it's very therapeutic for me. I had written an article for the American Academy of Family Physicians in 2014 about my experience with mental illness. And at the time, I thought, okay, this is a big gamble. Like, if I put this out there, what's going to happen? And how are people going to respond? And am I going to be in trouble, by my boss or whoever, And it was amazing that how positively people responded to it. And a lot of them were like, yeah, I had the same experience, or, similar struggles or whatnot. And some of them were completely surprised that others had that same experience.
Mm-hmm.
And so, it really kind of opened up a new way of looking at it for me, looking at mental illness in general, but also among healthcare professionals. And so I started exploring being able to share my story in different venues and avenues. And finally, I thought, well, why don't I just write a book? Like, that makes sense. There isn't anything like this out there.
Mm-hmm.
And so it took me 3 years. I initially was looking for agents before I had written the book, but had a proposal and everything. And a number of them said, like, well, I don't know, not too excited about that. And then finally, one agent said, this was probably the 40th agent I had queried. And he said, with the memoir, you should probably just write it first and then try to find someone. So then I focused more on the writing. And after I had finished it, I thought, I'm not going to bother with an agent now. I'm going to go right to publishers, which is what I did. And so it was published by Black Rose Writing, which is kind of a small independent press. But it allowed me a lot of freedom and independence in terms of what I included in there. And so I talk a lot about, first of all, kind of my backstory pre-medicine. I spent a little bit of time on there. I was always kind of an anxious child, but never anything extreme or clinical, I don't think.
Mm-hmm.
But then you can see patterns in my life where this is gradually increasing. And then when I'm in undergrad, trying to do all the pre-med stuff, and as the listeners know, it's so hard because you've got to get as good a grades as possible, and you got to volunteer, and you got to work, and you got to do research and all of these things. And so it led to me having a panic attack.
Mm-hmm.
And I thought it was something with my heart. I thought, my heart was racing. Maybe I was coming close to a heart attack or whatever. So I went to the doctor and said, no, it sounds like anxiety. And I thought, well, that's interesting. I'd never thought of that. But it kind of continued to get worse through medical school and into residency. And so I talk a lot about that. That's where the majority of the book covers is medical school and residency, and some of my experiences there that contributed to my struggles. And then when I was an intern, I was kind of hit with a very severe depression. And so it was just kind of the classic thing. It was so hard to get out of bed, to go do anything, to show up at work, and, to interact with my family, all of these things. And so throughout all this time, I had kind of had therapy off and on. I had had medication off and on and different types, and finally was kind of able to find what worked best for me.
Mm-hmm.
And so I explore a lot of that. And I try in the book to use my experience as a window or as an opening to the broader issues. And so it's not just about me, but it's also about the struggles as a system that we face or as a profession. And I include a chapter about a malpractice suit that I had once I had entered practice, and how that affected me. And so all of these different aspects, but I think I would encourage pre-med students and med students to take a look at it, only because I do feel like, first of all, you'll recognize a lot of the experiences you have there, hopefully not to the extent that I did. But then also, I think having an idea of what kind of the worst of what could come you can prepare better for that and be more able to handle it when it comes. And so I really tried to explore all of these different aspects of mental illness among healthcare professionals to really bring that a little bit more to the forefront of our conversations and culture.
I appreciate that because it is so prevalent, as you mentioned. We are not exaggerating. There are so many different struggles. And I think that all physicians, to be honest, we have a certain personality to matriculate into medical school. We all have some kind of anxiety or something underlying. And when you're under these stresses, it's exponentially grow. So our profession at this point in time is not very supportive of people with mental health struggles. There are some medical boards, once you guys get your licenses, where if you report treatment and things like that, they may not cover you or allow you to get your license or have certain stipulations. They may bring up these things if you have malpractice lawsuits, which a lot of doctors end up having just as a part of life. So it's about finding those resources and that connection and figuring out that you're not alone and how to make this topic not so taboo, because we are healthcare professionals and it is very surprising that mental health is such a taboo topic amongst ourselves. Yeah. And then just speaking on that, how do you think that we should work to change that culture?
Obviously, any sort of culture change is extremely difficult. However, I feel like we're really going in the right direction right now. When you look at different hospital systems and schools and everything, everyone's developing their own wellness plan or setup, which is really obviously a very important thing. Even the fact that they're thinking about it and they're realizing this is a big issue. And I think COVID has really amped up that need and the recognition by healthcare leaders that, wait a minute, this really is a big deal. We're going to end up losing a lot of physicians who will leave the profession or die by suicide or whatnot. There was an article just recently that said that 10% of physicians are considering leaving medicine altogether after COVID because it was so hard. Now, it's also interesting how, and you kind of alluded to this, how one of the toughest things in medicine that is the hardest thing is how we treat each other, because oftentimes we're just jerks to each other. And part of that is that's how I was trained, so that's how I'm going to treat you. But also, I think part of it is that everyone is going through some sort of difficulty if you're in this profession to some extent. And so a lot of the attending physicians may not have very much emotional reserve because they're suffering through the same things that we are. And so it's much easier to snap and to, be less than cordial and professional. But I also feel like that's improving. And that's a slow thing, obviously, because that is such an ingrained cultural aspect of medicine. But I do feel as though that's improving. But it is an interesting time. Every professional society is coming out with their own wellness activities and resources and everything. And I think the best resource for everyone to use is the one that you use, which sounds stupid, but there are so many different things out there, but there are only certain things that either will work for us as an individual or that we're willing to engage in. And so, the best resource is what you're willing to use. I think it's really hard. We always talk about, hey, if you're struggling, reach out or do this, which is absolutely true. But oftentimes people are already reaching out to you, and you need to accept that and to accept that there are people who care about you. There are people who want you to be successful in all aspects of your life. And so if there is any small amount of struggling with your mental or emotional health, then accept that accept the willingness of others to help you.
I love that. And I definitely think that it's true. Like there are people out there that care about you, as just us two. We both acknowledge that we've seen so many people go through this. So don't struggle in silence. Don't struggle in silence. Figure out what works for you. Or if you don't know, reach out for help. And there's someone that will be able to help direct you.
Yeah. And, again, I don't want this to sound all doom and gloom, because there are a lot of positives to it as well.
Absolutely. We're highlighting a very important topic just because we've been doing a lot of episodes on wellness and work-life balance and all of those things. But those things have grown out of the issues that we're talking about today. So we're trying to figure out ways to prevent that. Or if you're already experiencing it, to figure out how to come up with a game plan to how to make you feel well and how to allow you to care for yourself, because you can't care for other people if you don't care for yourself. So this episode isn't doom and gloom. Like, we're happy, we're here, we're open to help, but we just want to be transparent and vulnerable with you and allow you to know that you're not alone if you are experiencing something like this.
Yes, absolutely.
At Med School Coach, we know that studying for the MCAT exam can be challenging, especially for busy students on the go. That's why our team created MCAT Prep, the only all-encompassing study app built specifically for the MCAT. MCAT Prep by Med School Coach provides student access to extremely high-quality content and a personalized curriculum for free. The app has more than 250 videos, 1,000 flashcards, and 1,000 unique MCAT questions. Plus, MCAT Prep by Med School Coach allows students to create a personalized study schedule and track progress over time. You need every competitive advantage you can get to get into medical school, and now you can put the experts from Med School Coach into your pocket. It's the closest pre-med students can come to a personal tutor without spending a penny. Download MCAT Prep by Med School Coach for free at medschoolcoach.com/MCAT. Or download it directly from the Apple Store or Google Play Store. You can achieve your medical school dreams, and MCAT Prep by Med School Coach can help.
So you have shared so many wonderful pearls of wisdom and opportunities for further investigation and on all of our parts. What is one pearl of wisdom that you would like to leave for our listeners?
My mantra in life has become allow yourself some grace. And I really think that's important. And that can kind of mean whatever you need it to mean, except that it is about recognizing who you are and that you are fallible, and that's okay. We will make mistakes, and that's okay. And we can still overcome it. We can still be happy and productive, but just allow yourself some grace, no matter what you run up against in life.
I love that. And I really appreciate you for taking the time to join us today. I'd like to end our episode by giving you an opportunity to share how our listeners can reach out and listen or chat with you or contact you with any questions, where they can find your book, and just give you an opportunity to say goodbye.
Absolutely. So my website, kylebradfordjones.com, is kind of a way to find all sorts of stuff, but I would encourage you to buy the book, of course, because I'm the author, but go to the website to get it, because there's a link to a place where you can buy a copy from your local independent bookstore to help support them. But I'm on Twitter, Facebook, Instagram. All of those are at kbjones11. So you can find all of those things, but certainly reach out. I try to do some kind of funny or silly things on Instagram and Facebook, and I don't want people to think I'm making light of the topic, but I want it to be a little more accessible and a little more ways that we can connect and discuss it. So reach out on any of those avenues. I'd be happy to hear either your feedback or just say hi, or whatever it is.
Thank you so much. And we will put those contact information things in the show note. And I think that Dr. Jones brought up a great point about purchasing the book through his website, because we know what times we're in during the pandemic, and it's very important to support our local businesses. So that would be a great idea.
Well, thank you, Arkita. This has been awesome.
Yes, it certainly has. So thank you, listeners out there. Be sure to click the subscribe button, and I'll be here next week with another guest. Have a great day.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward med school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.